Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to discuss bipolar disorder, including its types, symptoms, causes, and effective treatment options. This article aims to provide a comprehensive overview of the disorder to enhance awareness and promote empathy towards those affected. Please share this information with someone who is just beginning to exhibit symptoms. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. Extreme mood fluctuations are the hallmark of bipolar disorder, originally known as manic depressive disorder. These fluctuations encompass emotional highs, mania or hypomania. They also include emotional lows, depression. Millions of people worldwide are impacted by this illness. It has a major negative influence on their everyday lives, interpersonal connections, and general well-being. Types of bipolar disorder. The pattern and severity of mood fluctuations differentiate each form of bipolar disorder. 1. Bipolar I disorder. This type is characterized by manic symptoms severe enough to necessitate immediate hospitalization or by manic episodes that continue at least 7 days. There are also usually 2-week-long depressive spells. 2. Bipolar II disorder, characterized by a sequence of hypomanic and depressive episodes, but not the full-blown manic episodes that are typical of bipolar I disorder. 3. Cyclothymic disorder, cyclothymia. This type of disorder is typified by episodes of hypomanic symptoms and depressive episodes. These episodes last for a minimum of 2 years, 1 year in the case of children and adolescents. However, the symptoms do not fit the diagnostic criteria for either a hypomanic episode or a depressive episode. 4. Other specified and unspecified bipolar and related disorders. These include bipolar disorder symptoms that do not match the 3 categories listed above. Symptoms and diagnosis. Manic and depressed episodes are 2 categories into which bipolar disorder symptoms can be classified. Manic episode symptoms are increased energy, activity, and restlessness. Excessively high, overly good, euphoric mood. Extreme irritability. Racing thoughts and talking very fast, jumping from one idea to another. Distractibility, inability to concentrate. Decreased need for sleep. Unrealistic beliefs in one's abilities and powers. Poor judgment leading to risky behaviors. Depressive episode symptoms are prolonged sadness or unexplained crying spells. Significant changes in appetite and sleep patterns. Irritability, anger, worry, agitation, anxiety. Pessimism, loss of energy, persistent lethargy. Feelings of guilt, worthlessness. Inability to concentrate, indecisiveness. Withdrawal from friends and activities. Recurring thoughts of death or suicide. A mental health practitioner must perform a thorough evaluation, which includes a physical examination, psychiatric assessment, and mood charting, in order to diagnose bipolar disorder. Due to symptom overlap with other mental health conditions such as anxiety and depression, misdiagnosis is frequent. Causes and risk factors. Though its precise etiology is still unknown, bipolar illness is influenced by a number of factors, including 1. Genetics. The tendency for bipolar disorder to occur in families suggests a genetic component. Research indicates that there may be a higher chance of bipolar disorder development in people with a family history of the illness. 2. Biological disparities. Bipolar disorder sufferers frequently exhibit structural alterations in their brains. Although the importance of these changes is still unknown, they may eventually aid in identifying the root causes. 3. Neurotransmitter imbalances. It is thought that abnormalities in the brain chemicals known as neurotransmitters, such as norepinephrine, dopamine, and serotonin, are important for mood regulation. These abnormalities may even be a factor in bipolar illness. 4. Environmental factors. Bipolar illness symptoms can be precipitated by or made worse by stress, trauma, and major life changes. Abuse of substances can also precipitate or exacerbate episodes. Treatment and management. Although bipolar disorder is a lifelong diagnosis, people with it can lead happy, fulfilled lives if they receive the right care. Medication, psychotherapy, and lifestyle modifications are commonly used in combination for treatment. Medications. Mood stabilizers. They are the mainstay of treatment for bipolar illness. They help regulate fluctuations between manic and depressive episodes. Antipsychotic drugs, used to treat severe episodes of depression or mania. Antidepressants may be administered to treat depression, but they should be used carefully since they might cause manic episodes. Antidepressant antipsychotic, a class of drugs that helps reduce the signs and symptoms of depression and manic episodes. Psychotherapy. Cognitive behavioral therapy, CBT. It is centered on identifying and changing negative thoughts and behavior patterns. Psychoeducation promotes improved symptom management by assisting patients in understanding their illness and available treatments. Family therapy involves treating patients' relatives, fostering better support and communication within the family. Interpersonal and social rhythm therapy focuses on stabilizing daily routines and rhythms in order to assist control mood fluctuations. Way of life and DIY solutions. Frequent exercise. Exercise has the potential to stabilize mood. Healthy diet, stability and general well-being are enhanced by a balanced diet. Sufficient sleep. Keeping a consistent sleep schedule is essential for controlling mood. Refraining from alcohol and drugs. Abuse of substances can cause or exacerbate symptoms. When to visit a physician. Even though bipolar disease causes dramatic mood swings, many sufferers are unaware of how much their emotional instability affects them and their loved ones. As a result, they frequently go untreated. Additionally, if you have bipolar disorder like some people do, you might find that the cycles of increased productivity and exhilaration are enjoyable. But this exhilaration is invariably followed by an emotional collapse that can leave you exhausted, unhappy, and possibly in problems with the law, money, or relationships. See your physician or a mental health professional if you have any signs of mania or depression. Bipolar disorder does not improve by itself. You can manage your symptoms by seeking treatment from a mental health specialist who specializes in treating bipolar illness. Challenges and stigma. Numerous difficulties arise from having bipolar disease, such as the unpredictable nature of mood swings and the effects on one's personal and professional relationships. Discrimination and social exclusion are further consequences of cultural stigma and misconceptions around mental health illnesses. In order to eliminate stigma, it is imperative that public understanding about bipolar disorder be increased. For people with bipolar disorder and their families, support groups and advocacy organizations are essential in building a supportive community and offering services. Although bipolar disorder is a complicated and sometimes misdiagnosed illness, people with it can control their symptoms. With the correct care and assistance, they can have happy, productive lives. Our understanding of this illness is being expanded via ongoing research, which will lead to better treatments and an enhanced quality of life for people who are impacted. Promoting mental health for everyone and helping those with bipolar disorder require education, understanding, and empathy. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.